First, I'm glad to be here. It's an honor to be invited to this meeting. For me personally, I'm very happy to meet my friends here in Emirat. They really took a good care of me every time I'm around. My talk will be about the ocular perfusion. Vascular dysfunction of the optic nerve head is believed to be a contributing factor in the development of glaucoma. We all know that the circulation of the optic nerve head up in the nerve fiber layer is coming from the central retinal artery. The prelaminar, laminar, postlaminar, they are coming from the short posterior ciliaries, and the postlaminar is also coming from the pia vessels. Ocular perfusion is the difference between the arterial blood pressure and the intraocular pressure. If you get the lower arterial blood pressure or a high intraocular pressure, then the perfusion will be affected, especially the arterial IOP. The arterial blood pressure is more important, being a larger in quantity. There are different things measured. The mean ocular perfusion pressure, it is the difference between the brachial blood pressure and IOP. What's meant by mean? It's meant 1/3 systolic plus 2/3 diastolic. And we take 2/3 of this value because this is the difference between the pressure in the brachial artery and the ophthalmic artery. Sometimes they measure the systolic perfusion pressure or the diastolic perfusion pressure. Large population studies showed that there is a reduction in the ocular perfusion pressure, and this is strongly associated with the prevalence of glaucoma. As you can see here in this huge number of study persons, the perfusion is a risk factor for the prevalence. Varies different studies between 3 times to 6 times more prevalence when there is a reduction of the ocular perfusion pressure. Again, most of the studies showed that ocular perfusion pressure was a better predictor for glaucoma than the IOP. There is a fluctuation in the IOP, and there is a fluctuation of the perfusion pressure over the day and from day to day. We all know that there is nocturnal hypotension, and there is extensive nocturnal hypotension in cases of glaucoma, especially in normal tension glaucoma. This study was done early in 1994. The author there, they got 166 persons. They measure the blood pressure and the intraocular pressure over 24 hours. And they noticed that over the nighttime, there is a drop of the blood pressure, systolic and diastolic, by 1/4 of the, or 1/3 of the cases. Also, it was noticed that this drop of the nocturnal IOP is more prone in cases of normal tension glaucoma. Again, disease progression. Glaucoma's eyes, they get disease progression, and this is more pronounced if there is decrease in the ocular blood flow than with eyes without decrease in the ocular blood flow. In this study in 2014, it was done by measuring the pressure every 30 minutes over 2 days. And they make a curve for the systolic arterial blood pressure and the diastolic arterial pressure. And they make a mean for the arterial IOP. And they found that the hypotension that occurred by night, if the drop is more than 10 milli compared to the daily average arterial, then these persons will show progression, especially in normal tension glaucoma. Now, recently we got the OCT angio. It's a way to see the blood vessels without injecting the material into the arteries. I got 3 areas that will help us to prove the importance of the ocular perfusion. This is the capillaries around the optic nerve head. This is in the nerve fiber layer. And then the disc vascularity, and lastly, what's known as the microvascular dropout. This is the radial pericapillary vessels. We don't see it with the fluorescein, but with the OCT angio, they can be shown. This is important because they are supplying the nerve fiber layer. In the OCT angio, you can either get the percentage of vasculature in the whole image or in the peripapillary area in a zone of 0.70 millimeter. This study was done over 261 patients, and it was found that the whole area, the 3 by 3 or 4.5 by 4.5 whole area vasculature around the disc is a very good predictor to differentiate between glucomatous and non-glucomatous eyes. The area under the curve for the whole area image is almost near to 1. It's 0.94. So it's very good predictor to differentiate between normal and glucomatous eyes. Again, there was the defect. We all know that the nerve fiber layer affection usually it's in the superior and inferior temporal area. Again, the vasculature in these areas was shown to be affected by the OCT angio. This study was done by Holon, published 2017. He compared the peripapillary area, the temporal area, compared with the field changes in the paracentral area, and he found that there is a good correlation between the less the vasculature and the field changes in the central area. Again, other studies checked the vasculature in the deep part of the optic nerve head. It was done here on 21 normal eyes and 21 glucomatous eyes. They were checking the vascularity at the level of the lamina cribrosa. The upper picture is of a normal and the lower one of a glucomatous eye. Optic nerve head perfusion showed significant difference between glaucoma and normal controls, and it was significantly correlated with the disease severity and the structural defects of the glucomatous eyes. Third part is the deep choroidal vasculature. If you have an OCT SWIP source, you can get OCT angio of the choroidal vessels. So in this picture to the right, you can see around the disc there is a small yellow area dotted in yellow. This area, you don't see the blood vessels in. So this is known as the microvasculature dropout. It's a focal area with sectorial capillary dropout without any visible microvasculature. I'll show you some of the studies found a correlation between such a vascular dropout and glaucoma. This is the first one. Here, the authors check cases with optic disc hemorrhage. And they found that eyes with optic disc hemorrhage, they get microvasculature dropout more. It's around 46% compared to eyes without disc hemorrhage, was only 29%. The second part of that study, it showed that cases of glaucoma progression, they get more microvasculature dropout, significantly higher than stable cases of glaucoma. This progression was found in both groups that they get disc hemorrhage or without disc hemorrhage. Both progression is there if there is microvasculature dropout. Another study compared the location of the microvasculature dropout with the peripapillary optic atrophy and when the field changes. And they found that there is a worse visual field loss and a larger area of peripapillary atrophy were associated with the microvasculature dropout. And also, they found that the location of the microvasculature dropout was topographically corresponding to the field effects. Another study was done on 37 eyes, and this study showed that eyes with microvasculature dropout, the lamina cribrosa defects was 70% compared to the eyes without. Also, the field effect, the mean deviation of the field effect was higher in the cases of microvasculature dropout, and the size of the area of beta zone in the parapapillary atrophy was larger when there is microvasculature dropout. Again, this study, the author get 31 patients with parafoveal scotoma in the central 10 degrees in one of the two hemispheres. And they compare it with another group of patients. They will get changes in the nasal area in the one of the two hemispheres and were free in the central 10 degrees. And they found that when there was affection in the central 10 degrees, 25 out of 32 eyes, around 80%, they get microvasculature dropout. On the other hand, the group with the nasal area affection, only 1 out of 42 eyes, they get this microvasculature dropout. So I'm going to finish by this recommendation of the Asia-specific guidelines. They say you need to consider the factors when you are taking the medical history for a glaucoma or a suspected glaucoma person. For the cardiovascular system, you need to check and ask about systemic hypotension, systemic hypertension, and if systemic hypertension is overtreated, there will be hypotension, especially by night, which may worsen the glaucoma, and we need to check for the vascular tendency, problems like migraine or Raynaud phenomena. Thank you.